Conduct disorder is an behavioral and emotional disorder, mental health issue among children and adolescents. Look at this picture shows that a behavioral and emotional problems are displayed here. Look at this. A detail going on. Introduction. Conduct disorder is a serious behavioral and emotional disorder that typically manifests in childhood or adolescence. It is characterized by persistent patterns of aggressive, disruptive, and antisocial behavior that violates societal norms and the rights of others. Individuals with CD often display difficulties in maintaining relationships, struggle academically, and may have a history of criminal activities. A definition. Conduct disorder is a mental health condition diagnosed in children and adolescents, characterized by a repetitive and persistent pattern of behavior that violates the rights of others or major age appropriate social norms or rules. The American Psychiatric Association defined CD in the Diagnostic and Statistical Manual of Mental Disorders under disruptive impulse control and conduct disorders. Etymology. The term conduct disorder originates from the Latin word conducer, to bring together, lead or conduct, and the Middle English disorder, lack of order or control. It is emerged in modern psychiatry to describe a pattern of persistent antisocial, aggressive, and defiant behaviors in children and adolescents. Types. 1. Childhood onset type. Symptoms appear before the age of 10. 2. Adolescent onset type. Symptoms appear after the age of 10. 3. Unspecified onset. Age of onset is unknown. Causes. The exact cause of CD is unknown, but multiple factors contribute, including 1. Genetic factors, family history of mental disorders like antisocial personality disorder. 2. Neurological factors, structural and functional abnormalities in brain areas regulating behavior and emotions. 3. Environmental factors, exposure to abuse, violence, or dysfunctional family relationships. 4. Psychosocial factors, poor parental supervision, peer rejection, and low socioeconomic status. Risk factors: 1. Family conflict and instability. 2. Exposure to substance abuse. 3. Parental neglect or harsh discipline. 4. Learning disabilities or neurodevelopmental disorders. 5. Traumatic experiences such as abuse or bullying. Complications: if left untreated, conduct disorder can lead to 1. Substance abuse and addiction, 2. Legal issues and incarceration, 3. Academic failure or dropout, 4. Development of antisocial personality disorder in adulthood, 5. Increased risk of suicide. Pathophysiology: conduct disorder is associated with dysfunctions in the prefrontal cortex, amygdala, and lymphatic system, which regulate emotional responses and impulse control. Neurotransmitter imbalances, particularly involving serotonin, dopamine, and norepinephrine, contribute to aggression and impulsivity. Pathophysiology of conduct disorder, step by step process. 1. Genetic and environmental influences. Genetic predisposition, family history of antisocial behavior or psychiatric disorders. Environmental factors, childhood malnutrition, neglect, exposure to violence, or inconsistent parenting. 2. Neurobiological dysfunctions, prefrontal cortex dysfunction, impaired impulse control, poor decision making, and lack of empathy. Amygdala abnormalities, reduced emotional processing leading to decreased fear and emotional regulation. hypoactive lymphatic system. Weak emotional responses contribute to aggressive and antisocial behaviors. 3. Neurotransmitter imbalances, lower serotonin and dopamine dysregulation, increased impulsivity, aggression, and risk taking behavior. Elevating testosterone and cortisol dysregulation, heightened stress response, and aggressive tendencies. 4. Cognitive and behavioral deficits, hostile attribution bias, misinterpreting neutral situations as threatening, leading to aggressive responses. Deficient moral reasoning, reduced sensitivity to rules, authority, and consequences. 5. Reinforcement and maintenance. Positive reinforcement of aggression, antisocial behavior may be rewarded, example peer approval, material gains. Negative reinforcement, avoidance of punishment or conflict resolution through aggression strengthens the behavior. 6. Long term neural and behavioral changes, chronic maladaptive behavior patterns solidify, increasing the risk of antisocial personality disorder in adulthood. Difficulties in emotional bonding and social integration persist, leading to further criminal or deviant behavior. The stepwise breakdown highlights the complex interplay of genetics and neurobiology, cognition, and environment in contact disorder. Signs and symptoms: 1. Aggression towards people and animals. 2. Destruction of property. 3. Deceitfulness, lying, or theft. 4. Serious violations of rules such as truancy and curfew violations. 5. Lack of empathy and remorse. A medical diagnosis: a diagnosis based on DSM-5 criteria and includes: 1. Persistent behavioral patterns for at least 12 months. 2. Comprehensive psychiatric evaluation. 3. Family and school history assessment. 4. Psychological testing to rule out other conditions. Nursing diagnosis: 1. Risk for violence directed at self or others. 2. Impaired social interaction. 3. Deficient knowledge regarding consequences of actions. 4. Ineffective coping strategies. 5. Low self-esteem. Medical management: 1. pharmacological interventions, antipsychiatrics, mood stabilizers, stimulants for comorbid ADHD. 2. Individual and family therapy. Nursing management. 1. Establish a structured environment with clear rules and consequences. Provide emotional support and counseling. 2. Engage in behavioral therapy techniques such as positive reinforcement. 3. Educate caregivers about consistency in discipline and positive parenting techniques. 4. Monitor for co-occurring mental health disorders. Treatment options. 1. Cognitive behavioral therapy CBT. 2. Parent management training PMT. 3. Multi systemic therapy MST. 4. Social skill training. 5. Medication for associated symptoms. Psychosocial medicine. 1. Cognitive behavioral therapy CBT helps children recognize and change maladaptive thought patterns. 2. Parents child interaction therapy PCIT enhances parent child relationships and improves discipline strategies. 3. Functional family therapy FFT aim to improve family dynamics and communication. 4. Multi-systemic therapy MST addresses multiple environmental influences including family, peers and school. 5. Anger management training teaches children to control aggressive impulses and develop emotional regulation skills. Prevention. 1. Early intervention programs in schools. 2. Parenting education programs. 3. Community based support services. 4. Encouraging healthy peer relationships. 5. Teaching problem solving and conflict resolution skills. In conclusion, conduct disorder is a challenging psychiatric condition that requires a multidisciplinary approach for effective management, early identification, comprehensive treatment strategies, and strong support systems are crucial in preventing long-term negative consequences by implementing psychosocial interventions and appropriate medical management. Individuals with conduct disorder can achieve better behavioral outcomes and improve social integration. Thank you. Have a nice day.